Before we dive into what functional vision head impulse testing actually is, let's go back a few steps and start thinking about the vestibular ocular reflex, because that's going to be key to understanding that when we move forward in this webinar. Now, the vestibular ocular reflex isn't something that's relatively new to us. We've actually been studying the vestibular ocular reflex for more than 100 years, dating all the way back to the development of irrigation of the ear to stimulate the vestibular ocular reflex through chlorics, moving into rotational chair testing, and then more recently through video head impulse testing. Now, head impulse testing really comes back from the bedside. So Hamagi and Kurthoys described this in the late 1980s, looking at eye movement behavior relative to impulsive head movements. We saw that that was then developed through the technological advancement of lightweight goggles and cameras into what has now been used for over 10 years in clinic, the video head impulse test. And what we're doing with that video head impulse test is really measuring the physiological function of the VOR at these higher frequencies, so complementary to our low frequency chloric and rotational chair testing. But this is a physiological reflex. So what we have discovered is that looking at eye movement behavior, so the idea of the eye moving equal and opposite to the head movement to give us good eye positioning for visual acuity, doesn't really give us any indication of function. And again, function isn't something new in terms of the VOR either. So if you look at tests such as dynamic visual acuity, the DVA test, or gaze stabilization, the GST test, these are tests of the functional VOR by assessing how well somebody can see by moving their head or moving their head quickly. But one of the things that really does start to become a little bit more interesting is we see this development in the healthcare field where function and physiology don't always marry up. So we want to have more information around what the functional status is of a patient. Now, with functional vision head impulse testing, it's really one step further in the functional VOR. So similar to the head impulse test, we're going to move the patient's head impulsively within the canal planes, but rather than just looking at the eye moving back onto a target, we're not actually going to look at eye movement at all. We're going to look at whether the patient can have good visual acuity during that head impulse. So like DVA and GST, the patient will see an optotype, a letter that's displayed in front of them that will appear during the head impulse movement. This is done passively by the clinician. As they recognize that optotype during the head impulse, that then gets scored in the system as a correct, or if they don't recognize it, an incorrect response. So now we're looking at visual acuity during the accelerative element of the head impulse. What that then tells us is not only does the reflex work correctly, so physiologically through the fvHIT, but also is it working functionally? So during those head movements, can our patient actually utilize that physiologic VOR to see clearly? And again, why does that become important? Well, if we go back and look at some of the evidence, there's many studies published that show poor correlation between the physiological improvement of reflexes, such as the VOR, fvHIT appearing to give normal VOR responses, and reported symptoms by patients. And we know particularly vestibular patients, dizzy patients, can be quite complex, and there's a lot going on. Now, one of the other elements of the functional vision head impulse test, which we'll touch a little bit more on today, is it's testing just beyond that reflex of the eye. Yes, we're looking at visual acuity, but visual acuity has got a lot of components. It requires attention. It requires precision within the central nervous system to actually do the correct timing to see that optotype clearly. So there's much more of a cognitive dual tasking purpose, looking at much larger areas of the central nervous system beyond just the physiological reflex. And that's something that we'll touch in a little bit more today, how function and looking at the eye movement on a real life basis can add a lot more to how we assess the patient in clinic.